am honored to be joined by Dr. Aviva Romm, a true trailblazer in women's health. Dr. Romm is a Yale-trained MD and board-certified family physician with specialties in integrative gynecology, obstetrics, and pediatrics. She also happens to be a world-renowned midwife and herbalist. A longtime home birth pioneer and birth activist, she spent her career challenging the status quo in medicine. Her best-selling books reflect her deep commitment to helping women understand and reclaim their health at every stage of life. She's helping us wake up to what's possible when we tune into our bodies, trust ourselves, and push back against the narratives that have kept us small, silent, and sick for too long. I want to dive right into it because you're working on a book called
Force of Nature.
The Best Title Ever.
Thank you for saying that.
What does that phrase mean to you in this context?
Yeah, so it means a couple of things to me. So one, I feel like so many of us at this intersection of our lives, this juncture, and it's an inflection point, but it can feel like a cliff that we're about to jump off of or fall off of, especially with the narrative in the menopause world right now. So for me, being a force of nature, it's just this, let's own it. Let's own that power because it's an expression, right? That's used usually about women who just have it going on, right? It's to me, when I think of when you think of a woman who's a force of nature, what do you think of?
Yeah, it's positive. For sure, it's positive.
Yeah, it's positive. It's strong. She's like blowing through a room. She's got it going on. Like there's a lot of strength and a lot of power and a lot of capacity. And also, it's a bit of a double entendre in the sense that menopause is literally a force of nature, right? This is a natural force that's happening. But sometimes it can feel like it's happening more to us than by us or for us. And nature is so variable in how we experience her, right? She can be a gentle spring breeze or a summer breeze, and you're lying in the hammock and you're like, oh, nature's so beautiful. And then it can be complete electrical storm, power blackout because of an ice storm. It can be a tsunami, a hurricane, certainly forest fires, right? And what's interesting about that too, if we go really, I was talking with a friend about this and she's like, yes, and also think about how many of those quote unquote natural disasters we're experiencing in escalating rates now are actually partly man-made in how we're living in the world. So as I'm unpacking this book, it's like, and it's funny, I've written a lot of books now, and I've always written books from the sense of like, I've been very fortunate. I haven't struggled with fertility, pregnancy, gynae problems. It's been a very smooth road for me. So I've written these books as the helpful doctor, midwife, friend next door. And now I'm really writing a book as I'm going through it too. So I'm feeling that full force of nature, that full intensity and variability. And I'm at times but having to remind myself this story of being done, or the best is behind me, or I've peaked. I have to remind myself those are stories, those are narratives that are not true. So that's what the book is about. And the book is much more than just a philosophical approach to menopause, though. It's really also all the how-tos to navigate this kind of, it's sort of like a field guide to the Wild West of menopause.
Oh, I love that. Let's just focus on the last word because I feel that nature is left out of this conversation. Sure, some people talk about go look at the sunlight or walk on the grass or whatever, but I have come to realize in my life that it's so magical, the things that are in the world around us and our connection to them. And just even the way our lungs, the trachea look like the branches of the tree, and the way our eyes look like carrots and walnuts look like brains. And I think, you know,
have you ever flown in an airplane and you're looking down at the earth below you and you're like, oh my gosh, the rivers, the streams, they just look like our blood vessels. It's just incredible.
Yeah. So I just feel really lost because I feel that this is something I have leaned into more and more and more as I've gotten older, this magical, universe that we live in that's reflected in us and outside of us. And I didn't mean to even get into this,
Yeah.
but I'm looking at the word nature and you're including that. Like, can you just talk to me a little bit about that and how it seems to be left out even more of the conversation?
Yeah, and it's kind of a complex historical conversation, and I'm going to kind of get a little political here too. So it's not, to me, only left out of the conversation, but it's actually slightly being disparaged. I saw somebody recently on social media make a comment in response to someone who had written in about, well, what about natural approaches to menopause? And the physician who was responding said, you took the birth control pill, you used air conditioning, you drive a car. And I was just like, true, and unrelated. What about natural approaches for women who prefer that? And I'm finding this is a very complex space right now, in that a lot of the menopause narrative is being driven by people who have primarily OB-GYN or urogynecologic surgical training. And that narrative historically, and when we go back historically, I'm talking about to the beginning of scientific method to science, when we talk about like Francis Bacon, right? There was this very clear separation of science from women's knowing. And not only that, there was a very specifically defined separation in that what Bacon said and Descartes reinforced, they reinforced each other's narratives on this at different times, over different time periods, but it's the same narrative that women's bodies are unreliable, women's experiences are unreliable, women's narratives are unreliable, as nature is unreliable, to the extent that women's bodies and nature are there to plunder as desired and needed by men. And this narrative kind of set an entire trajectory of healthcare and medicine, Western medicine, that really has persisted. There's a deep separation between women's bodies, women's knowings, women's experiences, nature, and what is considered best evidence, which is one very Eurocentric, very patriarchal, and very narrow. But it sets the tone for this narrative that's been driven about, for example, women and hormones for the past 50 years now, right? This forever young concept. Once women get to a certain age, we're dried up, we're arid, we're irrelevant, and thereby we need a medication or medical fix. And those fixes tend to not include historically scientific fixes, other than maybe like get to high altitudes and fresh air for tuberculosis. Historically, there's been much more of a medical surgical approach. And I think that we're seeing that reinforced now. And it misses a really important approach to menopause, which doesn't exclude science or medicine, medication, let's say, but it is way more inclusive and starts with things that we can do ourselves at home. It also looks at menopause and all the symptoms and problems that women often do experience in menopause as a problem with women's bodies, a medical decline in women's hormones that only a medical fix can really address, when all of the symptoms that we experience, or for the most part, have far more complex biopsychosocial causes than just the fact that our hormones have declined. So I'm a midwife and an herbalist and a medical doctor. I bring kind of all of this to the table. For me, I spend a lot of time in my garden, a lot of time hiking, a lot of time appreciating the therapeutic value of nature itself, but also have spent 40 years studying the very important role, for example, that botanical medicines can play, that other non-Western medical approaches can really help with, in conjunction with or prior to jumping onto medication for women who don't yet need it, don't want it, aren't sure, maybe want to try other things first, or can't use it for whatever reason.
It's kind of like I had someone say to me, I said, hormone therapy is like the icing on the cake. And this person said, no, hormone therapy is the cake.
Yeah.
There's a real divide. So what do
There
you
is.
want women to ask themselves? Because when you're going on social media, that conversation has really been captivated by a medical narrative, the one that you raised.
Yes.
So what do you
To
want?
the extent that it's described as women being castrated,
Yeah,
like there's this whole comparison. If men were castrated, we give them testosterone. Well, women are castrated. So why aren't we just freely giving hormones? Which I agree, we should have free access.
yeah,
Not necessarily free, ideally, that'd be great. No cost, but like we should have access to all the things we need. So, what
right.
do I want women to ask
What do you
themselves?
want women to ask themselves when they're hearing this? What do you want women to say?
Three questions. Three questions. How are you feeling? How are you really feeling? What do you want? And what do you need? And the intersection of those questions can help women find the answers that they need. Some women, for example, I have a patient who she was having very severe hot flashes. They were affecting her sleep. And also, she has a parent, a mother, who experienced early and significant cognitive decline in her 60s. My patient was in her early 50s. And from a philosophical perspective, she did not see herself as someone who would use hormones. She leaned into a natural approach. So the first question is, how are you really feeling? And for her, I feel awful. I feel scared about my dementia, and I wonder if I should try hormones at least preventatively. And she was in that age range where the literature does show that using them early may actually help with certain aspects of cognitive function. She was miserable with her hot flashes. She was not sleeping. And that was affecting her exercise, her diet, her relationship with her partner, because she was feeling just bitchy and irritable and ragey all the time. And so she felt awful, right? She felt really awful. So then what do you want? Well, I want to be able to approach menopause more naturally. Okay, here are all the things that we can do, but also what else do you want? I want to not be suffering. That's an important want. And then what do you need? And for me, a lot of times I help women bridge that gap. Like if they really are having mild symptoms, they want to take a natural approach. They don't need hormones for any medical reason yet, or because they're so significantly suffering, or even suffering at all. Like, I don't give be significantly suffering to do something, then that might take us down one road. But in her case, what do you need? What I really need is to feel better and not feel afraid. And so in that case, it was like helping her see that MHT, menopausal hormone therapy, strategically could help her possibly feel better and fill that gap. In her case, it did. In other women's cases, it doesn't, right? They don't actually get these miracle cures that were promised on the internet with hormone therapy. So, how are you feeling? How are you really, really feeling? What do you want? And what do you need? And then what's going to get you there, right? Like, what are the tools that you get to choose from that get you there?
Well, many of us never knew how to ask those three questions or answer them for ourselves either.
That's why I say, what do you really,
Yeah.
really, really? Yes,
Yeah.
it's very hard when we don't know. And I think we still need qualified guides to help us sort through, right? The safety questions, the what can bridge the gap, what are the options? Because we're already not sleeping, we're already stressed. Then I hear women who constantly, all the time, I'm hearing women say, oh, I read on the internet that if I don't do this, I'm going to end up with osteoporosis, dementia, blah, 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 urinary tract infections that are going to make me get dementia. So helping women to find the truth and the answers as best we know it, that's a lot to ask people who don't have scientific training, medical training, are in the sandwich generation of taking care of their parents and their teens, and who are exhausted and beside themselves. So, having those people that can help sort that out is really helpful.
So it sounds like you're a good person for me to ask this. If you're doing
Okay.
okay, should you go on hormone therapy to prevent or reduce your risk of future disease? What's your take on that question?
I would say it depends on which future diseases you're talking about and what your risks are. So let's say let's back up and say if you go into premature or early menopause, you have primary ovarian insufficiency, you've had a hysterectomy with your ovaries out, anything that's thrown you into menopause, really around before age 42 technically, but even before age 45. I do think that going on hormone therapy is important, right? We know that there are cardioprotective, bone protective, and brain protective effects for that subset of women, that it's sort of not that it's non-negotiable, anybody can do anything they want, but the benefits are so clear and so outweigh the risks of doing it, unless somebody has more significant risks. But let's say for everyone else going through kind of like normal perimenopause, normal early menopause, you're making a decision, you're in late menopause, post-menopause, you're trying to make a decision. If you already have some osteopenia, you already have some early signs of bone loss, and your mother had osteoporosis and had a fracture, and your grandmother had osteoporosis and had a fracture, I think it's reasonable if you're early on to, give things several months. If you can improve your bone density with lifestyle, weight-bearing exercise and dietary changes, adding calcium, for example, and see. But if it doesn't improve quickly, the risk of fractures in women is so significant, and not just the risk of fractures, but what happens to women who have had, for example, a hip fracture. That's real, and it's scary, and it's sad. And so if that's your history and the other things haven't to this date prevented you becoming osteopenic or aren't reversing it, absolutely. Or if you are osteopenic and don't have the bandwidth to do all the other things, or even if you're just afraid of bone loss and fracture, then that is considered a reasonable reason to go on to hormone therapy, estrogen particularly, and then if you have a uterus, progesterone to support that. For cognitive decline, there is literature that shows that for women in perimenopause and early on the menopause journey, doing hormone therapy may in fact help with certain aspects of cognitive function. But it only improves certain aspects and actually has a potentially mildly not great impact on other aspects. So while you might have improved verbal, you might have decreased spatial, for example, like there's some give and take. But overall, the benefits and the harms seem minimal and the risks are low. So if somebody is concerned, again, you have a history of cognitive decline in your family and you're worried about it, it's reasonable to try it, but the literature at this point doesn't give that in any way as an indication. And at this point, I've spoken with my friend and colleague Lisa Mosconi about this at length, and at least per our most recent conversations to date so far, she concurs, and she says this in her articles and books, that the literature, and for those of you who don't know Lisa, she's the world's leading neuroscientist on menopause, perimenopause, and brain changes. It doesn't support that or prevention of cognitive decline. Similarly, I don't think the literature supports going on to hormone therapy for the prevention of cardiovascular disease adequately enough compared to, let's say, a Mediterranean style diet, good exercise, and an overall healthy lifestyle. So, and those are the sort of big indications. As far as things like preventing vaginal dryness or preventing hot flashes, I would say, in my personal opinion and practice, I would say take a wait and see approach, because if you're having those symptoms, they may be mild, there may be other things you can do. But if any of those symptoms start to get in the way of your quality of life, not that you're suffering, but they're in the way of your quality of life, and you want to try it, totally appropriate.
Well, it's a lot more
But
complicated.
I do not believe all women need to be on it for everything. I don't believe most women need to be on it for everything.
Okay. That is not what we're hearing. So it's great to hear someone else explain that this is not decided. We have a few
Let me
people.
add in, if you don't mind, let me add in something about vaginal estrogen, because this is really important. If you are a perimenopausal or menopausal woman, or postmenopausal, and especially postmenopausal, not only is this where the literature the strongest, but the impact the most significant. If you are having recurrent urinary tract infections, that is a phenomenal indication to use some form of vaginal hormones. It can be vaginal estrogen or DHEA or a combination. I have treated women many, many times, older women. We're talking women 60s and beyond, and I'm almost 60, so I can say older women, mature women, but particularly women who are a good bit older, who come into the hospital with delirium because they are having recurrent UTIs. They're physically in danger of falling, they're in danger of wandering, and they're typically not urinary tract infections that are recurring due to chronic re-exposure or chronic bacteria. It's actually changes in the vaginal microbiome due to changes in vaginal estrogen that also create an environment for increased urinary tract infections. Frequent urinary tract infections that cause delirium are also a risk factor for real for ending up in a nursing facility. And it is a risk factor for developing dementia. So I think that not only does it help you sleep better if you're waking up at night a lot to pee, but if you're having genital urinary syndrome of menopause and your UTIs, phenomenal indication to use that preventatively. And vaginal estrogen is an entirely different creature to transdermal or oral estrogen in terms of its impact. That's very safe for most people.
Okay, that's great to hear you say that. So let's get into herbalism and botanicals.
Yeah, so, I would say there's the good, the bad, and not so much ugly, but so the good is that we have thousands of years of traditional Chinese, traditional Ayurvedic, and other traditional medicines from around the world that have historically supported women through this changing time in our life. And we don't read that literature and find where it is written down, find that women were suffering terribly, but also the voices of women tended to be a bit muted in that literature. And it's mostly written by men. But we do have a long history of using botanicals. That's the good. We also have naturopathic physicians and herbalists now who are using botanicals, often with great success, for women going through various aspects of perimenopausal and menopausal symptoms, whether that's mood or sleep or cognitive or iron deficiency anemia or heart palpitations or hot flashes. There's a panoply of beautiful herbs that we can select from. I would say the less good is that, much like there has been an incredible dearth of research in women's health in general that we're, finally hearing about more publicly, which is really important, there's an even more significant dearth of research in botanical medicines for women's health, because unlike with a pharmaceutical, there is at least some incentive for pharma or research institutions to study it because it will eventually become a patented profitable drug. With botanicals, there's very little research that we would call good randomized controlled double-blind placebo studies, for example. There are some, but they're limited. But there are some good studies, for example, that have come out of Germany, out of Israel, out of other places, and some from the US. But we still have a long way to go with that. So when we think about herbal medicine, and I mentioned this earlier, that when we only rely on the randomized controlled clinical trial, it's actually quite Eurocentric, quite patriarchal, quite white-centric, in that basically we're saying that every other tradition is not valid and not adequately studied, even though some of these traditions have existed for thousands of years, right? And people are using the same things handed down generation after generation with good safety and reported efficacy. We want to be careful to also not romanticize and say, well, just because somebody used that traditionally means that it is actually effective. So it would be nice to have more studies. So we've got the good, we've got the historical use, we've got the herbalists who are using it, the naturopaths who are using it, some intrepid physicians who are using it. We've got the questionable, we don't have enough data. The absence of data doesn't mean something doesn't work. It just means we can't prove that it does work. But then we also have a very complicated botanical medicine industry, particularly in the United States, which has, sometimes one might say, less than stringent oversight. And so claims can be exaggerated. We don't always know that what the label says is exactly what's in the product. We don't always know the quality of those ingredients. So it can be a little bit challenging to, as a consumer, to know what products to use and what products to trust. And again, exaggerated claims that can then start to get perpetuated in many different spaces.
And just like with hormone therapy, you can have side effects.
Yeah.
You can have side effects as well. They can be powerful. Can you talk about that?
They can be powerful. I would say that botanical medicine research demonstrates that overall the side effect profile of most of the botanicals that we would commonly use, which does not include toxic botanicals, those wouldn't be in common use, or more restricted botanicals, which wouldn't be in common use, are on a head-to-head basis far safer than most pharmaceuticals. And the adverse drug reporting with botanicals is much lower. But there are risks. Anyone can have an idiosyncratic reaction. So you can be allergic to something, you can have a reaction, I can have a reaction that's not the average reaction. Botanical products can be adulterated or contaminated, meaning somebody's added something to it that wasn't listed on the label. We do see that more commonly with botanical products that are imported from Asia, partly because in Asia, there's not really, it's all seamless, right? So you might have a product that has an herb in it and a pharmaceutical in it, but that isn't necessarily all transparently listed on the label. There can be substitutions. Sometimes a company is low on something and adds something else in it. So just a random example right now, we're seeing there are some substitutions happening with echinacea. They may be also some contamination of other herbs that are getting mixed in. Now, echinacea is known by studies that were done in Canada to be relatively safe during pregnancy, but that's echinacea. But we don't know what happens when something else ends up in the product that isn't the echinacea. And then we have the risk of herb-drug interactions. So somebody can be taking botanicals and pharmaceuticals that don't bode well for the way that the pharmaceutical is metabolized. But overall, the side effect profile is very safe. There really aren't herbs that people are using. I mean, you'd have to use a lot of hops, a lot of sage to even get in the realm where you're considering something like endometrial cancer or breast cancer. So yes, we're more careful with people who have those risks, but overall, they're generally safe. But there are certain things too. For example, turmeric. We know turmeric is a great anti-inflammatory. It may even have some adaptogenic effects, so some ability to support our stress response. But when you start boiling it down, not literally, but extracting it down to curcumin, or when someone is taking large amounts of turmeric because they're seeing it's an anti-inflammatory and perimenopausal and menopausal women have inflammation and it's being promoted, you're not hearing on the back end that it can actually cause gallbladder issues. It can cause gallstones. It may have a harmful impact on the liver. And interestingly, we know, for example, from just basic science, basic medicine, that women in their 40s and over who have higher levels of estrogen, and we know that estrogen surges in perimenopause, it doesn't just decline, and women who are carrying more weight and still in their reproductive years actually have a higher risk of gallstones. Now you add on turmeric and somebody needs to be saying, hey, just pay attention, there could be a problem, or let's make sure this is okay for you. So botanicals have a great place. There's a whole consortium of European botanical organizations. There's a book called the German Commission E, which is a regulatory guide used widely in Europe. And for example, there's an herb called motherwort, Leonoris cardiaca, which is one of my favorite herbs, which is officially used in Europe for anxiety, heart palpitations, and night waking from hot flashes. It's approved, right? You can find it in a pharmacy. We know that an herb called chasteberry or vitex, even though the studies aren't robust, there are a couple of small studies that suggest that women might actually get improvements in hot flashes and night sweats. Night sweats are a common reason that women wake up from sleep. Both incredibly safe herbs for most people to use. So there are options out there that are just, I think, part of it is that, and I have huge respect for the Menopause Society and follow the Menopause Society's work, but basically they came out with a kind of a white paper, a statement a few years ago that kind of, we don't endorse any botanicals, and there's not enough evidence for the use of any of them. I disagree with that. I think that if you can find someone qualified and get good information, they're absolutely worth a try. We know that lemon balm, lavella, which is a studied lavender oil product, passion flower, there is evidence for these for sleep. Probably more robust evidence, stronger evidence than actually the benefits of melatonin, interestingly. So, no, there are options that are worth looking at. And I think it's really important because I think the message in the menopause space right now is that it's sort of do hormones or suffer. And there are women who, for many reasons, philosophically, they just don't want to be on a pharmaceutical. They maybe medically can't be on a pharmaceutical. Now are being told, well, you can do mindfulness, you can exercise, you can change your diet, but that's all. There's nothing really
Right.
other than that for you.
This is the third way. This is kind of like a third.
It is. It is a third way. And that's really what my book Force of Nature is about, is the third way.
I love it. I'm all about the third way and everything. So
yeah.
Have you come across, are you aware of, do you deal with pycnogen?
It's an extract from pine bark, and it too may actually have some anti-inflammatory benefits and some cognitive benefits for women. It partly acts as what we think of as an antioxidant, and it has great safety, overall safety data. So there's no reason somebody can't add it to a protocol, and really not any significant herb drug interactions that I know of with it.
Well, that stopped my hot flashes.
I love it. Absolutely. There's limited data, like again, the absence of research doesn't mean it's not effective, but there is some data, and I absolutely include it in my protocols with my patients for hot flashes too.
You mentioned two of my other favorites, hops.
Yeah.
Lights out for sleeping for me, and sage. So why would you use those? Yeah.
Yeah, so it's funny. I just found an article I wrote back in like 1988. It was a medical journal article for a botanical medicine, integrated medicine journal, where I was talking about these. It's funny to go back and go, wow, I've been using these for a while. So sage and hops are two of the very few herbs that actually do have estrogenic effects. So measurable changes. Again, limited studies on how significant those changes are, which is important to know because it may be significant for some women. So in my medical practice, when I have a woman who has a history of estrogen receptor positive cancer personally, I do tend to avoid hops and sage. She can use sage as an aromatherapy mist, but I avoid the tea, and I avoid the tea of hops. But hops is a wonderful sedative herb. I've got a whole fence of it growing in my garden. It's gorgeous. It's what we use in beer. To give it that we say the hopsy flavor. It's the bitter principle in beer. It is a bitter, which means it's not only important for liver and digestion, but it's calming for the nervous system. Bitter principle is calming for the nervous system, and it has other constituents that soothe the nervous system. So I don't use it for daytime anxiety because, like you say, it can be really lights out. But as a tincture, which is an extract, or in capsules, wonderful before bed. You can use the tea. It's one, not very pleasant tasting, but two, I tend to not use tea for perimenopausal and menopausal women within a couple of hours of bed. If you're having sleep trouble, you drink a cup of tea, you fall asleep, and then you're waking up 2 hours later to pee because you had a cup of tea. Sage, similarly, does have some mildly estrogenic effects. It also can bring on the menstrual cycle. So both herbs are completely contraindicated for women who are pregnant or trying to conceive. So if you're perimenopausal, but still in that window of possibly wanting to get pregnant or trying to get pregnant or not on contraception, you need to be thoughtful about using those herbs. But sage has traditionally been used to cool women down. So whether as a gentle tea, which can be combined with hops, to take in the evening, again, not within a couple of hours of bed, or a tincture or capsules, it may help with hot flashes. But what I love sage for is in a spray bottle, like a little bit of mist to cool down. So I tell perimenopausal women, keep it on your desk in a little spritz bottle, use it, have a little fan. You'll breathe in some of that aromatherapy. It's calming too. But those are two wonderful herbs that are not widely used.
And when you're looking at the mainstream menopause, mainstream medical menopause, I call it sometimes.
Yes.
You're looking at that conversation. What do you think?
Menopause.
Yeah. What do you think's really being left out?
Yeah, I think that what is being left out are options as we're talking about, right? Thinking about it's very black and white, I feel, right? It's either you use hormone therapy, and there's a hat tip, right? There's definitely a hat tip to we still need to eat well, we still need to exercise. But I guess let me back up and say I feel like even though the message is very empowering, right? There's a really powerful let's take back menopause. Let's take back our choices. Let's have a full wealth of choices. We're looking at those choices being very narrow. And it's still in the context of menopause being this horrible decline. And I think what's being left out is that, yes, if we don't take care of ourselves at this juncture in our life, there can be serious consequences. But what can we do to reframe menopause as it it is a natural transition. It is hard. It's like saying pregnancy isn't natural. I mean, things can go wrong. Things can be really hard. Having a baby can go wildly difficult and be hard, but there's still natural life inflections. And how can we embrace the totality of it? I don't feel like approaching menopause with this idea that we're being castrated is very empowering. It still feels like we're fighting against something, right? Like we're fighting our bodies, we're fighting this inevitable decline. That feels like an old story to me rather than a much more how can we own being a force of nature, even if we feel like it's difficult in the moment? What can we do to be optimally healthy? And I don't feel like there's enough emphasis being placed on what many of us have for a long time called root cause approaches, right? I've been using that term for 40 years as an herbalist. What are from a more scientific perspective, we can call it exposome medicine. This is an entire branch of medicine with a research center at Columbia University. And exposome medicine came out of the field of environmental medicine. What are the impacts of all of the external forces on our health? So, how are we looking at stress, the workplace, our relationships, also cumulative exposure to environmental toxins that we know act as endocrine disruptors, our gut microbiome, and our diet, our trauma histories, our cultural narratives that we've internalized that are driving us, even sometimes when we don't know it? I feel like that conversation, the nuance, is perhaps what's missing. What else is missing from the mainstream menopause narrative right now? For decades, for decades as a midwife, and I'm a midwife, I practiced for 20 plus years, and I'm a Yale-trained MD with an internship in internal medicine and a residency in family medicine with obstetrics and gynecology, a specialty, and a specialty in integrative medicine. So this is
You're
something
just
that
very,
I
very
was,
legit on this. You're just like,
yeah, and I'm just like really saying I'm legit on this. And the medical narrative has been so centered on the OB-GYN model. And now we see the entry of the OB-GYN, Urogyn, urologist model. These are very powerful branches of medicine and very important that have also historically been male dominated, surgically dominated, and medication dominated. These are branches of medicine that have historically seen women's bodies and all of the phases we go through as lemons. And all of the people who are in the menopause space talking about these things right now had also had zero training in their medical and surgical residencies about menopause. So they're figuring it out as they go along too. All the while, midwives and nurse practitioners have been holding it down for women. All these decades, we've been talking about perimenopause and menopause. We've been providing lifestyle, botanical. We never stopped using hormone therapy or talking about hormone therapy. We got more cautious after the WHI, but we didn't stop. And part of what's missing from this conversation is the midwifery nurse practitioner narrative, because it's a woman-centric narrative that looks at the whole woman and has never historically been just medical surgical. It includes that, but it's not just that. And so I'm like, where are the midwives? Where are the nurse practitioners? I train them in my online training programs. They're there. I've got hundreds and hundreds of them. They're out there. They've been doing the work all this time. They're still doing the work. And that voice is not included in the narrative. And I think that's a powerful, incredibly important voice.
Okay, and I'm noting the new and sort of surprising entry of the GLP-1 layer. And
Yeah.
you need hormone therapy, but what you also need are, the GLP-1s. And
Yeah.
it's gathering steam.
It's alarming.
Okay.
It's alarming. So I am a family doctor. Family doctors do most of the metabolic and diabetes care in the United States. We do 90% of it. Most people cannot access an endocrinologist. And a lot of the narrative of GLP-1s is being driven from pockets of people who are, again, medical, surgical, endocrinology. And I have used GLP-1s for quite some time in my medical practice for patients who meet the indications for them. And they can be incredibly effective, incredibly powerful medications because not only do they help reduce weight, which is a physical struggle for many people, a metabolic struggle, but also hugely demoralizing when you're trying all the things and you're not getting effects. And there are many, many reasons based on epigenetics, exposures, lifestyle, diet, genetics that make it very difficult for some people to lose weight. I mean, we live in an obesogenic society. We live in a society that drives overweight and obesity. And these medications can not only help with that, but they can help prevent and reduce the risk of cardiovascular disease that is higher in people who are struggling to lose weight and who have blood sugar issues, right? So they're a wonderful medication. However, my personal approach is that they are not a vanity medication. They're not, I'm 10 pounds overweight because I'm in menopause or I'm postpartum. Let me just hop on that. And they are being widely distributed as sort of like the go-to just because. I believe everyone has a choice to use these medications, but I also think that we have to take into consideration at this point, some of them are incredibly expensive. I mean, $1,000 a month, that's more than most people can afford. People feel driven to use them. And some of the messaging that's coming out right now around them is almost like there is really no other way to systematically and effectively lose weight. No diet has been proven to really be effective. True, no one diet has been proven to be more effective than the other for anyone. But we do know that leaning into a Mediterranean style diet brings benefits of reduced blood sugar, improved metabolic function, reduced risk of diabetes, reduced risk of dementia, and can be really helpful with weight loss. And I'm not even getting into the whole like conversation around weight because that's like that in and of itself, like what defines overweight? And so people can be overweight, and I'm doing air quotes here for anyone who's listening, meaning on medical metrics, they can be in a bigger size body than, let's say, what is defined as underweight or normal weight. But one can absolutely be 100% healthy in a bigger body. You can be metabolically healthy, cardiovascularly healthy, cognitively healthy. Being in a bigger body does not mean you are heading down some like dead end track. So we're talking about the difference between overweight and then medical obesity, which is an unfortunate term. And there are some terms that are being possibly replaced, like chronic disease of blood sugar metabolism or chronic disease of metabolism, which I think are healthier terms because we have so much stigma around weight. But the way that they are being promoted now, and it's not going away anytime soon. It's not even like, I saw one influencer in the menopause space. The question wasn't even, do you need a GLP-1? or do you need hormone therapy? It was literally phrased as, when are you starting your GLP-1 and hormone therapy? It's a given. And I think it's so easy to forget. And I don't mean to sound conspiratorial. I'm saying this as a physician who worked at a major research institution with major funding there, pharmaceutical funding. There are billions being made off of this right now. And it doesn't mean that we don't need them, that some people don't need them, but I'm very concerned. And they're not without consequences. They're not without side effects. And those, we're still very new in understanding what those are, because the more people that use a pharmaceutical, the larger the pool, the more we start to see the side effects that were buried by smaller numbers of people using them.
Yeah. And
some of those are being dismissed too, right? Like, here's one of the things I'm seeing happening in the menopause space. If a physician or healthcare provider in any way brings up a critique, like I did a post that was a little bit of like, yes, GLP-1s are great, and here's what we also need to know. And I was sort of called out for, as if that was somehow fat shaming, which is ridiculous. No, first of all, I would never fat shame anyone. I mean, I as I said, we can not only be healthy in all kinds of bodies, women come in all kinds of bodies and gorgeous bodies of all sizes and shapes and colors and varieties. But if you call out any of these risks or side effects, and somehow you're being anti-feminist, or you're accusing someone of cherry picking, so it's like you're shouting into the wind.
Yeah, there's some crazy deflection going on. Is that the right word for it?
Yeah. I think it's a good word.
And I think people need to remember that people are being paid to talk about these things on social media, and they're not always being transparent.
100%.
I've been offered $1,000 a month to go on hormone therapy and make reels about it. I am not in the fitness space, but I imagine people are being offered that kind of money or more to go on GLP-1s and talk about them.
Well, there's a huge campaign going on right now, which I'm saddened about, because it's a person I respect tremendously, but inarguably the GOAT of all athletes, with a partner who has a financial investment in these medications, shutting them out. And again, not to say that any individual shouldn't have the right to choose to use them, but they have a medical purpose. Mm-hmm. And I'm a physician who prescribes medications. I have no horse in the race to prescribe or not prescribe. It's just, let's look at the actual research and when they're indicated. Is it indicated for you, or is there just massive pharma promotion happening behind the scenes?
I don't think people realize how extensive the tentacles of that are, and how much people are adopting it and saying it. Like, people just soak it up and then say it. And you're talking about Serena Williams, and just look at the conversations and all the posts that have been made about that to see how it's twisted and bent, and all the kind of crazy arguments are coming out about it. Yeah, you don't have to be a conspiracy theorist to know that the pharmaceutical industry has a lot of money and spends a lot of time on messaging and gets those messages out in ways that we can't see.
And it's not just the pharmaceutical industry, it's the nutraceutical industry. It's to some extent the botanical industry. It is the supplement industry, which is, the nutraceutical. It is the protein powder industry. It is the greens industry. I don't take any money from any of those. I don't do ads or promotions or anything like that. It's a slippery slope. And again, just because someone makes money or takes money or has ads doesn't also invalidate the therapies. People have a right to their economy. No, but it gets very confusing.
It does get
for the consumer.
Yes, and we all need to make money. We're having sponsors at this summit, and it's my first experience with having that sort of relationship. But all you can do is sort of choose things that you feel good about and be transparent when you're being paid. I think that's quite important.
I mean, I have a relationship with a supplement company. I don't have a supplement line, at least not at this point. But people ask me all the time, where can I get these things and safely? And I just give the same access that I give to my patients. It's a different formulary, but it's a practitioner only formulary. And I do make a small percentage off of that. I also donate a lot of money to maternal health organizations through that too. But it's also, how do people get the access if they don't know? So I'm again not casting aspersions. It's just important to know,
Mhm.
and it's not just there. It's the labs industry now too, right? So women being told they need certain labs. There is no value to checking estrogen, progesterone, or testosterone in perimenopause or menopause. I saw something yesterday. If you are doing some protocol or intervention that somebody had, that you should get your FSH checked and your LH checked. Like, this is not science. It's just bad information.
Okay, that's really important information. You slipped in there right at the end because a lot of division on that too. There's a lot of people thinking
Yeah.
labs and we'll see what's going on there. And then there's women trusting those over the way they feel.
And I think that labs can be really valuable. We know from the MacArthur study on aging, certain labs can really help us know, do we have inflammation, metabolic dysfunction? These are high cholesterol. These are important things to know. But we also have different ages and different parameters for when those labs, it's not just everyone do everything all the time.
And your estrogen's declining. If you're going into menopause, that's something we know for sure. Your hormones are.
It is, but it can also be surging, right? We
Right. Yeah.
we all
Well,
know that roller coaster of emotions. I had a really funny incident when I was in my late perimenopause. I was sitting on my beautiful gray wool sofa because my kids are grown, so I can have a beautiful gray wool sofa. And one of my daughters, I have four kids. My middle daughter was visiting. My youngest three are my girls. And we were sitting and we were watching a movie and we had a fire going and we were sitting next to each other on my beautiful gray sofa. And I got up to pee. And girl, there was like a blood stain, like like that feeling like, oh, I feel a little wet.
yeah.
What's going on? But I hadn't had a period in
Hemorrhage.
like 6 months. Girl, it was like a flood. My daughter just was like, Mom, are you okay? And I was like, I'm fine. Perimenopause. She's like, are you a teenager? It was just hilarious.
Yeah.
But it was because we had estrogen surges. I had a nice thick endometrial lining and boom, then I had an estrogen decline and it all came down. Yeah.
Yeah, this is a more nuanced conversation too because it's becoming out more. It's estrogen surges and falls and maybe adding estrogen during that time isn't. I don't know, where do you fall on?
Yeah, no, it might not be what you need at all at that time.
Yeah.
I think what's happening partly is that we had such an intense promotion of hormone therapy in the 50s and 60s, right? This whole forever young concept, this fountain of youth, women are dried up, shriveled up, and useless over a certain age. And we see that, like if you watch Mad Men, for example, how women are talked about at a certain age. But then we had the WHI, right? The Women's Health Initiative study, which was like, oh my God, hormones are going to cause cancer in everyone. And we know that data was not all accurate, not properly interpreted. But then we had a lot of women for a couple of decades who just weren't getting support. They weren't getting the therapies they were needing and they were suffering.
Mhm.
And now we have a very empowered, very wonderful, very powerful, and very internet savvy, vocal group of women who are really saying we have the right to take back power and we have the right to have these medications. And I think part of what's happening is the pendulum is still swinging, right? Very far in one direction. And I think it's going to kind of recalibrate to a healthier place. And I think what's going to happen is there are going to be a lot of women who try hormone therapy and get benefit. There are going to be a lot of women who that really wasn't what they needed. They needed other things. We're going to have a lot of women who try hormone therapy but don't do the lifestyle things and are disappointed to find that they still have some of the downstream problems. We're going to have women who try GLP-1s and get benefit. We're going to have women who try GLP-1s and have significant side effects. We're going to have women who stop it, gain the weight back. We're going to see all kinds of things. Right now, we're sort of in this pendulum swing and everyone's playing in the sandbox. And I think it's important to remember that anytime something is trending, we're going to hear all about it. And if you're following that, especially on the internet, you're going to end up in a really big echo chamber where you're going to hear a lot of it. And there are well-known biopsychosocial biases that when humans hear the same thing over and over, even if it's untrue, we believe that it's true. even in the unquestionable evidence that it's not, we still will believe it's true. And so right now we're in a very big echo chamber with a very big pendulum swing. And I think getting back to, something you said really importantly about the labs is women are doing things but not necessarily paying attention to how they feel. So I think it's important to remember that right now we're seeing a lot of information. It's important information. It feels bigger than life. It feels like it's everywhere, and it feels like we should all be doing it. But remember, that's going to settle, right? We're on a curve where something is really popular. And if we think back to like 5 years ago, it was hormone everything. It was gut health everything. We go back a little before that, it was juicing everything, intermittent fasting everything. And I do think a happier, healthier place is somewhere in the middle. Look at all the truths, but remember those exaggerated. If it sounds too good to be true, if there's potential product alignment, if you're hearing the same message over and over and it's product or medication promotion, just be intelligent, be a savvy consumer, and try not to let the fears drive you, not the fears that you're castrated and in this inevitable decline, because that's not true either. And there's so many reasonable things that we can do, lifestyle, diet, all that bucketed as natural, but also there are also more medications than just the ones we're hearing about. There are lots and lots of options for our mood, for our sleep, for all kinds of things. So yeah, back to, how do you really feel? What do you really need? What do you really want? That's important.
I love it. I love that you're reminding me and everyone else that these are great questions.
I have to remind myself. I was out to lunch recently with a dear friend of mine, and we're exactly the same age. We're like 3 months apart. We're both 59. And she is an avidly athletic, fit, gorgeous, incredibly in shape woman who is healthy medically. Her sleep could be a little better, a little vaginal dryness, but nothing major to write home for. And we're having our tea. And she said, I'm really afraid I missed the boat on something that I should have done. And now I'm really afraid that I'm going to just have all these problems. And I'm like, wait, but you don't have the problems now. And there's no reason you should have those problems. It's not too late to start, but let's unpack where are you getting these fears? And again, it's that echo chamber of we have to do these things or we're going to fall apart. Our teeth are going to fall out. We're going to end up in a nursing home. We're going to have broken bones. We're going to look 1,000 years. I mean, even that, like we're avoiding the anti-aging message, but we're doing all these things to not look our age.
Yeah, it's well worth thinking about because when someone's trying to sway you with fear, it's best to have some suspicions. It's best to be a little skeptical, I think.
That is a marketing tactic.
Yeah, it is. You are a force of nature, so I can't wait to see your. Thank you so much. Thank you so much for taking the time to lay that all out. There are so many important nuggets in this interview. I'm really pleased. We need common sense and looking at whole women. So thank you so much.
Pleasure. Thank you.